It's a pleasure to welcome you today for what I consider the cherry of the cake of this event, and I'll tell you why. It's not because it's communications, and that's my field and my passion, but it's because we need to understand how do we get the information we talk about here, the knowledge we share about here, the ideas we discover here, to audiences outside of these four walls of cardiovascular health advocates and professionals. And who is the right messenger? On that note, I would like to welcome to the stage Miriam Vidal-Valero, a science journalist from Nature, from Mexico City originally, but based in Washington, D.C. If you can sit here, please. Thank you. And Daniel Valero, who is a cardiologist from California, who is also an influencer, and who has a podcast, Facts versus Fiction. We were supposed to be joined by another panelist, but a long story about travel and missed flights, basically, she won't be here with us today. We will try to connect with her later and just give her 5 minutes to share her story, because these are very interesting as well. But before I give the floor to this star team and let you hear from them, I just want to start by answering the questions that journalists try to answer all the time, and it is why. So why are we having this conversation? I think what you see in front of you speaks more than words. It's a comparison of coverage, percentage of coverage, New York Times, versus causes of death versus the coverage that they get in New York Times. This is specific to the US, but I think it can be extrapolated for a large part of the world. And we see here, we know cardiovascular disease is the #1 killer. If we didn't know that, we knew it from the report we launched yesterday. 20 million people died from cardiovascular disease in 2021. Yet it gets 2.5% of the media coverage, as you can see in front of you. And we have other issues such as homicide, terrorism, suicide that get the bulk of the coverage. So this session is about getting the facts out, getting the ideas out, getting people excited about their health and about the knowledge that can empower them. And for this to happen, we need to have an honest conversation with our audiences. We need to have quite a transparent and respectful conversation with our audiences. We need also to be able to have an exciting conversation with those we want to reach. And for this to happen, we need to build a respectful relationship, a relationship that is based on trust. How do you build trust when you're dealing with complexity? How do you build trust when you're dealing with doubt? And when uncertainty is what makes people like you, doctors and scientists, discover new horizons every day. So let's get straight into it. My first question will be about how do you deal with doubt and uncertainty, to both Danielle and Miriam. And I would like just to ask you to start with giving us your very spontaneous answer to that question in less than a minute, and then we'll jump into a more deeper dive discussion. Danielle?
Well, thank you so much for having me and for allowing me to be here. I think that acknowledging uncertainty as a physician, as a huge part of our career, is one of the most important things that makes a physician evidence-based and patient-centered. One of the hardest things to communicate to patients is uncertainty. It's much easier to be the doctor that has an answer for everything. It's much harder to be the doctor that is communicating honestly and saying, sometimes we don't know. And I think that that is one of the most important things in healthcare, to build trust with our patients, is just acknowledging the uncertainty. Acknowledging uncertainty doesn't mean that patient care has to fall to the wayside, that we give up. It just means that we are being transparent with patients about what we do know with regards to outcomes, treatments, different options, and work with them as a team as opposed to, losing patient trust by over-exaggerating what we may or may not know.
Thank you. Miriam?
Yes, thank you so much also for the opportunity to be in this panel. I agree with what you said. Particularly in my field of work, in journalism, I realized that, again, scientists have a hard time dealing with uncertainty, but basically the best way is to level up with people and not be afraid of letting them know that you don't know, but also why. I mean, I think speaking about the process and where you're at, it's very, very important. I am going to expand more on this later. Yeah. That's basically, yeah.
Thank you. And let's then continue. Being a journalist myself, actually, one of my favorite quotes is by George Orwell, and you'll see it, but I insist on reading it out loud. When I sit down to write a book, I do not say to myself, I'm going to produce a work of art. I write it because there is some lie that I want to expose, some fact to which I want to draw attention, and my initial concern is to get a hearing. So, you are a journalist writing for the New York Times, currently Nature, Medscape. What role do you think science journalists play in combating fake news?
Well, I think science journalists are basically the mediators, and we're basically sometimes even the translators between scientists and society. Our job mainly focuses on trying to get to people the most accurate facts, which sometimes can be difficult when we're basically dealing with a lot of different issues at the time. We're not experts. I like to say that we're very expert in everything, but really not. So our main job, I would say, is to be working in team with scientists, something that I really want to stress in this panel. Mm-hmm. I think it's very important that scientists and journalists learn to work together. And for that, I think it's very important for scientists to understand how journalism works.
Yeah. Maybe I would be interested to hear more about what are the challenges you face when you're working on a story, and if you can just give us an example of a scientific story, fact that you wanted to bring to a wider audience, and how you approach that.
So I am going to give an example that doesn't have to do right now with medicine, but I think this could also apply to medicine because, again, medicine is science. Last month, I was assigned to cover on deadline, which means that I basically had like 3 days to get up to speed, to cover a story about astrophysics. There was a paper that was coming out, and the results were very, very exciting to the astrophysics community, and of course, the people who were interested in astrophysics. So my job was to find experts, try to understand the paper, try to understand the findings, try to get up to speed with the backdrop story of that paper, and then write a very, very easy, understandable story on a very complex, scientifically complex paper in 3-4 days. Easy peasy, yeah. Just another day at the office. Yeah. When I basically, and this has happened to me twice with 2 different astrophysics papers in the past 2 months, and I'm going to compare experiences with one and the other so you can basically see the challenges. I love astrophysics and I love astronomy. That was one of the main reasons why I got interested in doing science journalism when I was starting my career. At some point, I just stopped doing it, and I stopped reading about it because I have so many things on my plate that I can just follow up with all the topics. So I was kind of rusty on the issue. The first time that I needed to do this, I interviewed the scientist, and then the scientist started talking to me in a very, very scientific way, which of course it's his right. I'm supposed to be the informed journalist who did, her homework before interviewing the guy. And then I started listening to the interview to get the quotes, and I was like, I don't know what this guy is saying. Like, I thought that I understood him, but now I have more doubts, and I kept going, listening to the quotes, going back between the quotes and the paper, and I was like, I don't know how I'm going to translate this. This is very, very difficult. He didn't even give me a metaphor, nothing. This is a disaster. in the end, I was able to get back to him and just ask some follow-up questions after doing a lot of Googling and getting my facts straight. And the article came out. The second experience was with this different scientist. She was a woman. She was amazing. I could tell that she had done interviews before and that she was media versed. And when I say media versed, is that she understands that scientists were not experts. She explained to me everything like she was basically giving a science communication discussion in a science museum. Basically, her paper for dummies, which I honestly really, really appreciate. Because again, it's my job to translate her findings. It's my job for people to know the facts. And for people to know the facts and for me to be able to do my job accurately on deadline, I need to understand them really, really, really quickly. I can do my part of the work, but I think one message that I really want to convey for scientists is that scientists sometimes need to understand that journalists, we can't be experts on your particular field and we can't be experts on you. As much as we want to, as much as we respect your work, we're dealing with a lot of different things the same way that you are in your day-to-day. So trying to really, really level up with us, understanding that we're people too, not experts, that's, I think, the best way for us to be teaming up and actually doing successful science communication.
Absolutely. I think you described one day in the office at the World Health Federation being part of the communications team. It's when you ask the scientists to tell you to explain something, actually often the explanation gets more complex. So you have to do the first circle to go back to an explanation that will resonate with audiences. I have another question for you from a perspective of an organization that actually wants to promote their story, wants to promote the data. We're often told by journalists that it's not newsworthy enough, or they have another 20 stories to report on. Mm-hmm. So it's very difficult also to break through from our perspective and to make ourselves stand out. How do you go about choosing what stories you cover?
So one thing, usually I have different ways of choosing a story. When I was freelancing before I joined the Nature staff right now, and I basically get assignments, we get tips. It's very different things working on staff than working as a freelancer. But when I was freelancing, I was trying to find new papers, something that looked interesting, and then from time to time I would find something that looked awesome, and then I tried to reach out to the scientists, and then voila, we have a story. As I started getting more experience in my career and working on staff and working on other assignments, I realized that that's basically just the tip of the iceberg to be able to find stories. Yeah. What I, again, would like to convey for all the scientific people here, all the people from these organizations that want their stories to come out, is that journalists were hungry for tips. I know that it may not seem like it, because sometimes, as you were saying, we don't answer emails, and we keep telling them that it's not newsworthy, all the things that I'm guessing you have faced at some point when trying to deal with journalists. So let me explain a little bit of how journalism works. Even though scientists and journalists, we're not working together, that doesn't mean that we can't team up. Scientists, people from organizations, you have your goals, your objectives, you have your agenda. Journalists, we basically live under different goals and objectives. We cannot be cheerleaders for science, and we can't sometimes choose a story. Sometimes it's not even that we don't find it interesting, it's that the editors don't find it interesting, it's that the story is not right for the particular outlet. That doesn't mean that we want to stop communicating with you. If we don't answer an email, it's basically maybe because it got lost in the many, many emails that we get daily. Please try again. If by the second time we don't answer, that doesn't mean that your story is not good. Maybe try to find another journalist. Or maybe you can ask the journalist, okay, you can't cover that particular story. Do you have any suggestion of who can I contact so that I can pass that particular tip? Journalists, again, one of the main things that is important in our jobs is to basically develop relationship with scientists and sources. If a journalist at some point approaches you because we have some questions, we need an expert, stay in touch with us. If you have some upcoming research, if you have some upcoming event, let us know that it's happening. Maybe there's a story there. We want to know the things. Another thing that I would say that it's also important is try to make yourself available to us. One of the things that I find sometimes most challenging when I am reporting a story is that I can't find the experts. And it's either because you're not answering your emails, or I found you in the paper, but then you don't have a website, you don't have an email. I go to the institutional website and I can't find an email.
Make it easy.
Try to make it easy for us, for us to find you. In Nature right now, for example, we have a very great initiative. It's called the Diversity Tracker. So we're basically trying also to diversify the sources, not always interviewing the same person and not always interviewing the same population. We want more women. We want more people with they, them pronouns. And honestly, I can't tell you how many times I try to reach out first to the diverse sources. They don't answer. And I am on a deadline, and I sometimes end up interviewing the same person. If you can't take the interview, for example, just refer to us to someone. You as a scientific community, you can help each other out also.
It's about respecting deadlines as well, I think.
Yeah.
That you also have deadlines.
I have deadlines, but that doesn't mean, if you can't answer, that doesn't mean that your colleague can't. If you also team up as a scientific community, understanding how we journalists work, you can boost each other out.
Talking about boosting each other and being more vocal and being proactive. You recently authored an article on Nature about online harassment of climate scientists.
Yes.
Which actually highlights a very, very disturbing trend of death threats and abuse directed at researchers. Could you tell us a little bit about what that exactly entails, and how can scientists protect themselves from such an outcome?
So there is not like this is the ultimate shield that will protect scientists, and for that matter, even journalists, from online harassment. I know that after I started working at Nature, I have been receiving emails, when I cover a specific story, like very kind of like aggressive emails from people who do not agree with the story and have their own agenda. Usually what I do is I just disregard those emails. When you're dealing with very problematic issues, or when you're dealing with very, important issues, you're bound to suffer from this. But there are ways to deal with this too. First of all, remember that you're not alone. You're a part of an institution. You can ask for the help of your institution to deal with this. Talking again about fake news. Mm-hmm. You can work again with journalists, and there are also organizations. I think Media Center in London, they have like this campaign working with scientists. So you can go to them and ask for advice, ask for help. They can connect you with journalists, so they can basically help get the right story out, the facts out, the story that you want to know. Remember that even when you get this harassment, and it seems scary at the moment, that doesn't mean that a lot of people or the majority of people agree with that particular view.
It's just that they're the loudest sometimes.
It's just that they are the loudest sometimes.
That's what comes to the surface. But that comes, I think that comes, thank you, that comes with, if you want to be out there, you are exposed. And there is certain risk to being exposed. Thank you, Miriam. I'll go now to Danielle, talking about being out there and being an advocate for health, for cardiovascular health, and for wellness in general. You are a cardiologist. You see patients every day, but you're also an influencer for hundreds of thousands of people. You have a podcast that's called Wellness Facts versus Fiction. Why did you decide to start that podcast? What prompted you?
It's really a great question. So as a cardiologist, I've done the traditional, training en route as everyone in the US. You go to 4 years of medical school, 3 years of internal medicine residency, 3 years of cardiology fellowship. And every year, we all go to AHA, we go to ACC, we go to our conferences. I've been lucky to present at many of them. And, we sit there in a room and we discuss things like confidence intervals and p-values, and even cardio Twitter is a super active form of communication. But even within cardio Twitter, we have people arguing over different statistical methods and things like that. And I realized that we have such robust conversation within our community of physicians and scientists, but who's translating that to the patients? And as a physician, we really should be doing that every day with every patient encounter, right? Because with every patient we speak to, the vast majority of our patients are not physicians, they're not in healthcare. And so especially with the pandemic, I think everyone saw a rise in a lot of health misinformation, disinformation. And so I just always have just started sharing evidence-based medicine information on social media and encouraging other doctors, younger doctors that are coming up to do the same, because whether or not you ask your patient, the truth is the vast majority of our patients are consuming a lot of their health advice online. It used to be TV, it used to be the radio, now it's Instagram. Even if they're 70 years old, it's Facebook. And so I really believe we have to try to meet patients where they are, and outnumber the amount of voices that, like you mentioned, the small few that are loud, outnumber those with guideline-based, evidence-based medicine expertise. One of the things I love to do is explain what expert consensus means, why all of our guidelines, whether it's the ESC guidelines or ACC or AHA, are all very similar, and how the scientific process and method works. And so I think our generation of physicians really has to make a concerted effort to meet patients where they are in and out of the office.
How do you do that? How do you talk about methods to patients or to people who are not necessarily in the field, but who will benefit from all of this, even if we talk only about prevention?
That's a great question. So one of the big areas of misinformation, I'm sure every cardiologist in the room will nod their head when I say this, is about statins. I think all of us have definitely interacted with probably, vast majority of patients that we've seen that have any issue with statins heard from, whether it was their neighbor or Facebook or Instagram, that statins are bad for you and all these things. So I always approach the patient with, first of all, empathy. It's not the patient's fault that they believe this misinformation. Truthfully, all of our patients, they're doing the best they can every day to be healthy, and they're following information they feel that will guide them there. And so how do I talk about a patient with methods? Well, I will actually explain to patients. I think that leveling with the patient, explaining to them in a language that they can understand, I will say, that Instagram post, of course, was very well designed and maybe looked catchy and said statins are going to kill you. But I explained to them we have a lot of randomized controlled trials, which are trials where patients are randomized to a placebo versus the drug. And these trials have demonstrated numerous times that in patients with coronary disease, this helps to reduce morbidity, mortality, so death, things that are important to you and the patient. It actually doesn't take too long to explain to the patient, but I think the most important thing is to ask the patient. Ask them, what is your concern? Why are you worried about statins? Where did you hear that? Hear them out, and then redirect them to what the evidence-based medicine is. And the truth is, Rome wasn't built in a day, so sometimes to generate that kind of trust and relationship with a patient, it's going to take multiple visits, and it may not happen the first time.
Yeah, and it's again about how do you manage to establish that connection, be it with the patient, be it with the journalist, when there is a lot of doubt and uncertainty involved.
Right. Mm-hmm.
Maybe what I would be interested to hear is a very specific example of a myth that you helped dismantle.
Yes, sure. So unfortunately, one of the most popular myths, I think, on social media now is that LDL cholesterol doesn't cause atherosclerosis, which for everyone in this room, we all know that it unequivocally is a huge part of the atherosclerotic process. And so this, unfortunately, has led to this large community of individuals who follow a really high saturated fat keto diet, which, because if you eat a really low fiber, high saturated fat diet, it can skyrocket your LDL. And it's kind of led this community to believe, well, their LDL in their scenario is not dangerous. So I saw a patient in the hospital who was, had an acute STEMI after following this high saturated fat keto carnivore diet. LDL was previously 120, had been in the 350s, 400s for 5 or 6 years, had acute proximal LAD STEMI. He was only in his 40s, no other risk factors. And what was sad to me was that it took that event for him to actually realize, oh, so having that high of cholesterol actually is dangerous. But I think what was more impactful was discussing with him how those myths online, at the end of the day, the people creating those myths online, they're not the one that's in the ICU with you after you've had your STEMI. They're not the one that's telling your family, that they just had a heart attack. And so this patient became an advocate himself and started to really dispel the misinformation online as well. And so that's why I try to reiterate why, there's no one physician that knows everything. It's just impossible. That's why we have guidelines. That's why we have expert scientific consensus. That's why we have multiple, brilliant minds ranging from clinicians who are cardiologists to scientists to healthcare advocates making, using the latest evidence to create evidence-based care. And so communicating that to patients can be a little tricky, but I think it's the next wave of how we have to go.
Do you think there is a risk of being too exposed, and is this really for everyone to make that bridge? And earlier we spoke with Miriam about climate scientists being too exposed, being then attacked, but also a lot of them are taking to the streets, and there is an impact there.
Yeah.
We've known about climate change. It's been a climate crisis for the last 70 years. Yet it was only when people took to the streets when it became something that everyone talks about.
Right. Well, I think that if a physician says, I don't want to get involved in social media, I don't want to be communicating that way, I totally understand, I respect that. Not everyone has to do it. If just a fraction of us are out there sharing evidence-based medicine, that makes a huge difference. It doesn't have to be everyone, just a fraction of us. But I think in general, really just having honest, transparent conversations with our patients and just working together to outnumber the amount of individuals who are sharing the misinformation. And it tends to be that the climate change deniers actually tend to fall on the same, there tends to be an anti-statin, anti-climate change, anti-vax. They all similarly have, they're in one group.
Absolutely.
So, we have to approach them with compassion, empathy.
They should attend the summit.
Yeah.
We should be speaking to them as well. That's probably, and hopefully the next step, not just speaking here, but also inviting people who don't agree with us.
But remembering that those individuals are, that's someone's mom, that's someone's dad, that's someone's best friend. They are the victim of misinformation. It's not their fault. And to approach them rather with frustration, with empathy, understanding, and trying to explain to them where they were misled.
We have to wrap up. So just one last piece of advice for healthcare professionals when it comes down to bridging the gap between what happens in the lab and what concerns every living person on the planet with a beating heart. Just 20-second soundbite.
I would say come with compassion, come with empathy when you're discussing with your patients and meeting patients where they're at.
Thank you. Miriam?
Communicate with journalists so we can help you get the facts out and try to explain to people that science is fallible and that science is completely building up itself over and over again.
Thank you. This was not planned, but we didn't coordinate that. But actually my ending was on Nietzsche's quote, who says, "It's not doubt that will drive you mad, it's actually certainty."
Perfect.
Thank you so much. Let's give a round of applause to our amazing panelists.